Good morning. I'm Muriel Bowser. I'm joining you from the Marion Barry building to provide an update on the district's response to COVID-19. I'm joined today by the city administrator for the district, Kevin Donahue, the deputy director at DC Health, Patrick Ashley, the state superintendent for education, Christina Grant, and the chancellor of DC Public Schools, Louis Farabee. Today, we will spend quite a bit of time talking about our plans for the return of our students and staff from their winter break. And we will continue to ask and report on our entire experience with COVID, including our testing and vaccination strategies. So with that, I just want to emphasize what we've talked about in the last couple of weeks, our emphasis on testing, indoor mask mandate, expanded vaccination mandates for DC government workers and access to certain establishments, our testing and vaccination centers that are planned, and everything that each of us can do to continue to help us through this winter surge. So with that, I want to turn to Patrick Ashley from DC Health to talk about a few numbers.
Thank you, Madam Mayor. Yesterday we reported 1,868 cases. As we've talked about over the last week or so, we are in the middle of a winter surge of cases. With our weekly case rate of being 1,915.2 and our daily case rate of being 273.6. As we talked about at the last press conference, the good news here is that our hospitalization rate has stayed low at 2.6%, and we'll talk a little bit more about hospitalization in the coming slides. And our vaccination rate continues to creep up. We obviously want to encourage everyone to get vaccinated. We're at 65.8% of individuals that are fully vaccinated, and we want that number to get to 100. And so just a reminder to make sure you're getting vaccinated. So you'll see here, this is our daily case rate that has certainly climbed over the last week and a half or so, where we've seen substantial increase in cases, which is as part of the reason we're here today to talk about what we are doing in response to this. A key point we've talked a lot about is hospital capacity. And so you'll see here there's 4 different graphs, and we'll walk through each one. The data that you're looking at is the data for the month of December. And so on the left-hand side, you'll start with the first day of the month all the way through yesterday. And the top graph in green is looking at our hospital capacity. And so at the top of the chart, this is indicative of how if the hospitals were if they were totally full, that chart or that line would be at the very top. What we see over the month of December is that our hospital capacity has stayed relatively stable. Today it is at 74% capacity, which means that there's 26% of the beds available for use for patients. And so that's a good indicator of our hospital capacity. We've been working very closely with our hospitals to ensure that they are ready for any increases in patients that they may see. The next chart down refers to the number of adult ICU beds that are available in our system. We can see again that this fluctuates throughout the month. That is totally normal, and we see that in pre-COVID times as well, where we'll see that fluctuate on a day-to-day basis. But you'll see that there is not substantial changes in the amount of ICU bed availability for adults or for pediatric patients. And the final graph at the bottom is the amount of adult ventilators that are available. And this has stayed relatively constant for the last several months. And that's because we've become much better at treating COVID. We're seeing far fewer patients that are on ventilators. But we've certainly seen more hospitalizations in the last month. And so this is the daily inpatient admissions to the hospital. And so this is to be expected. We are now seeing that case rates for COVID-19 are substantially higher than we saw a month ago. And even though our hospitalization rate is low at 2.6%, it is just because of the sheer volume of cases, we are seeing more patients in the hospital. We've been in daily talks with the hospitals to make sure that they are prepared for this. I'm happy to report that, they are prepared, and they have been prepared all the way through the pandemic with us. The graph you're looking at now is a comparison of the types of or the age of patients that we are seeing in the hospital. And so the chart on the left is for all of the admissions to the hospital for all of December of 2021. And this was including the period before we had a surge of patients, surge of cases in DC. And if you look at the chart on the right, it demonstrates the patients that are in the hospital in the last week. What you'll notice here is the demographics of these patients are the same. We're seeing the same trends. The graphs are slightly different in numbers, but we're seeing the same ages of individuals that are hospitalized here in DC. And that's good news for us. We're not seeing significant changes in the types of patients that were hospitalized. And we're not seeing substantial amounts, again, that 2.6% of patients that are hospitalized. But we did see in the last week that we saw 50% of our hospital admissions for the entire month of December in the last week. And so it is something that we are very closely watching. So today, under Mayor Bowser's leadership, we're announcing a $15 million grant initiative to the hospitals. This funding allows the hospitals who have been hit hard by COVID-19, especially with their staffing costs, to get some financial relief so that we can ensure that they are prepared for any COVID patients they may see. So $5 million of the $15 million is base funding, which is given to them on a percentage of their operating beds. And then $10 million provides them relief based on the amount of additional funds that they have spent on temporary staffing services. And what we know about the hospitals today is that approximately a quarter of their staff are out on isolation or quarantine. So COVID is hitting them just like it is hitting us in the community. And so they do have increased pressures for staffing. We also see in the hospitals that more than twice the number of traveling nurses or temporary nurses that are in the hospital than pre-pandemic times. And those traveling nurses come at a tremendous cost of $160 to $200 an hour per nurse, which provides a substantial cost to the hospitals. And so this grant will help them get some needed relief and ensure their preparedness. We've talked a lot about the importance of getting boosted. And we know that being boosted, fully vaccinated and boosted, is the primary way to prevent you from any severe illness or death. We know that the difference between being boosted versus unvaccinated is you're 10 times more likely to become infected and 20 times more likely to die when you look at being boosted versus unvaccinated. And so that's the story. We want people to get fully vaccinated. We want to keep them out of the hospital. We want to keep them safe and well and also preserve the hospital capacity. So you'll see here on the chart, the blue lines represent the vaccination rates for each age group, with the yellow lines representing the booster rates for those age groups. And so we have a lot of work to do to get individuals fully vaccinated and boosted here in DC. We're proud of all the individuals who have gotten vaccinated in DC, but we want to bring those booster rates up. So we've got vaccination opportunities available throughout the district at our walk-up locations. They're available at more than 150 locations throughout the city, at pharmacies and doctor's office throughout. And we talked about this a little bit at the last press conference, but also want to just highlight the fact it's so very important our individuals that are age 65 and older are really considering getting boosted. Those are the individuals we see are most likely to end up in the hospital, to end up dying from COVID-19, and so it's so important that they get vaccinated. And so what we're doing to help that is making sure that they know that they can come to the front of the line at any of the district-operated vaccination locations. You can see those on the screen. Those change on a daily basis and are published on the mayor's social media account. All they need to do is come to the front of the line, tell them that they are age 65 and older, and they don't have to wait in that line. So as we pivot and talk a little bit more about testing, isolation, and quarantine, the chart that you're looking at on the screen is testing rates per 100,000 of individuals. And all of the lines on the graph are representative of the 50 states in the United States through data available from HHS. And what we see, that top green line, is our testing rate per 100,000. DC has always led the way in testing, but in the last week we have substantially led the way in testing. And we appreciate and are proud of the DC residents who have taken advantage of the testing apparatus and to know their status so that we can stop the spread. That graph also does not include any results that are reported through our over-the-counter report. It is just PCR testing, and so we actually have additional testing that is available here in DC. And so over the last week, we have distributed more than 108,000 rapid antigen test kits to DC residents. And as a reminder, each of those kits contain 2 tests each. So that's about 216,000 tests that have been distributed out and are available. We've talked a lot about our supply. We have supply that continues to arrive and to bring us up to the full complement of the supplies that we hope to have to make available to all of DC residents. 16,000 individuals have reported their results to coronavirus.dc.gov/over-the-counter. And it's important that we get that information so that we know who in the community is testing positive and also negative. And so just a reminder to report those results to us. So on the screen, there's a number of opportunities to get tested this week, both for our PCR-based testing and also for our rapid antigen testing. For the December 31st, the 1st and the 2nd, we will have rapid antigen tests available at our firehouses the same way that we did the day after Christmas to make that available. So that is a change in our schedule from where they would normally be available at the libraries. They will only be available through the firehouses on Friday, Saturday, and Sunday. And then we do have PCR testing available throughout the week as well. So what we want you to do if your rapid test is positive. So earlier this week, the CDC announced some guidance to us that DC Health is currently reviewing and is in the process of updating our own guidance documents. And so we'll talk through what that guidance is. And so the first step is that we want individuals to start isolating from other people. And so as soon as you know that you're positive, don't wait, remove yourself from that situation and start your isolation process. Step 2, we want you to report those results to us. And that's coronavirus.dc.gov/over-the-counter. And then we want you to continue to isolate for 5 days, making sure that you're not around any other individuals. And if the DC Contact Trace Force calls you, we want you to help them do their job and stop the spread and provide them information of who you might have been exposed to. After those 5 days, we want you to continue to wear your mask. You may leave the house, but we want you to continue to wear your mask and be aware of individuals that may be immunocompromised, that we're not being around them, and that we're being very strict about adhering to that mask wearing to prevent spread. The CDC also updated the guidance for individuals that says, regardless of the vaccination status, a person who tests positive for as long as COVID-19 can leave that isolation for 5 days, as long as they don't have a fever, as long as they have no symptoms or their symptoms are improving, and again, wearing a mask for those 5 days. And it's so important that that mask is worn properly, and that's over the nose, tightly fitting, and that's wearing it consistently, regardless of whether that's somebody that's in your household or out in public. The CDC also updated their close contact guidance, and again, DC Health is in the process of updating this guidance currently. And that guidance says that if you are a close contact, if you have fully vaccinated and boosted, or you're not yet eligible for a booster, and so that means that it might be within 6 months of taking that your second shot. We want you to wear a mask around others for 10 days and test on day 5 if possible. You are no longer required to stay at home and isolate for that period, and that's if you are fully vaccinated plus a booster or not yet eligible for a booster. If you're unvaccinated or you have had your first and second dose of shot, you're eligible for a booster, but you've not yet been boosted, we want you to stay home for 5 days. And after that 5-day period, you're going to wear a mask for 5 additional days. But if you can't quarantine, you must wear a mask for 10 days and test on day 5 if possible. So again, we're in the process of reviewing this guidance. We'll provide additional updates on coronavirus.dc.gov/health guidance and through all of our different channels in the very near future. Since the beginning of the pandemic, we've also worked to make sure individuals have access to housing and food if they need to quarantine or isolate. And so there's a number of resources to be available for food access. And that's district residents can apply for SNAP, TANF, cash assistance, medical benefits, and they can learn more about that through districtdirect.dc.gov. There's also a number of options for individuals to receive food in their houses, and we'll continue to publish that information on our website. With that, that's the health update, and back to you, Mayor Bowser.
Thank you, Patrick. And so I just want to emphasize the information that we provided on getting boosted. We will, several of our agencies, including DC Health, will be doing specific outreach to our seniors, including our Department of Aging and Community Living in DC Health will have a specific outreach plan for our congregate settings with seniors. So please check up the walk-up vaccination sites. Mid-January, recall that in addition to all the private pharmacies and the grocery stores, the district will add a complement of retail spaces supported by DC Health for testing and vaccination. So stay tuned for that. We are now turning to our public education return from winter break update. DC Public Schools and Chancellor Farabee will lead this conversation. I want to note that Superintendent Grant has also been in close contact with DC Public Charter Schools. And we will be able to speak to, in general, some questions there. Dr. Farabee.
Thank you, Mayor. DC Public Schools continues to ground our planning in the value that the best place for our children to learn in our schools. To that belief, we will continue to operate schools to the great extent possible. As with any essential operation, the goal is to keep all of our classrooms and schools open as much as possible, but do so in a way that we continue to keep our students, our staff, and our families safe. In regards to that safety, we are working to maintain all of our health and safety protocols. You may be reminded that there are a number of protocols that we have implemented to ensure that our environment is safe. We will continue all of our health and safety measures throughout the remainder of this school year, which includes our masking, our HVAC enhancements, our asymptomatic testing protocols, our cleaning protocols, and our ask, look screening as students arrive on campus. If families want to learn more about these health and safety measures, they're welcome to go more to our website, to dcpsreopenstrong.com. We will also continue to ground in our situational virtual transitions as we think about the belief of maintaining as much of in-person learning as possible. We should expect classrooms or schools or grade levels to temporarily transition to a virtual learning posture as needed throughout the remainder of this semester, in the coming weeks, and throughout this school year. All of these decisions we do not take lightly. We will continue to move quickly as possible and will be guided by the health and safety protocols, guidance from DC Health and health authorities, and with our student and staff safety in mind. As we think about our situational virtual transitions, we will continue to work to ensure that families are notified of any transitions as quickly as possible. In the event that an entire school needs to be transitioned to a virtual posture, that time period will be up to 10 days, and that is 10 calendar days. Decisions about classrooms and grade levels at a particular school will also be made on a case-by-case basis. We will communicate the transitions to families on a daily basis on each evening by 8 p.m. If there are any extenuating circumstances, we would operate outside of that, would also notify families as quickly as possible. We make these decisions, as I mentioned earlier, not lightly, but we are guided by our health authorities, and we also consider continuity of education to ensure that we're providing the most appropriate learning environment for our students so they continue to feel loved, challenged, and prepared. And then we also consider staff operations. We look at staff availability by percentage. We also look at the percentage of students that are impacted by positive cases or are impacted by the need to quarantine. Again, those decisions will be posted each evening by 8 p.m. We are also continuing our efforts to advance food access as well. We have 15 sites that will serve as pickup sites for Monday, January 3rd and Tuesday, January 4th between 10 a.m. and 2 p.m. And then we will also transition all of our sites for virtual learning throughout the coming weeks to places in which students can also receive meals. And we will communicate that directly to those impacted schools should there be a need to transition those schools to a virtual posture. In regards to the coming days and when students return to school, there will be a mandatory requirement to produce a negative test for students to return to school. All DCPS student staff will be required to provide proof of a negative COVID-19 test before returning to school on Wednesday, January the 5th. And I want to share a little bit more about what that means for our staff and our students as relates to producing their negative tests. For our staff should report on January the 3rd between their regular reporting time in the morning and noon to pick up their rapid antigen test, and they should administer that test by 1 p.m. and produce results accordingly. Staff can pick up the test at school, or they can utilize any of their tests that they've received outside of the DCPS distribution at our city sites, or any of the antigen or PCR tests that they purchase or receive privately. We're asking again that they report all of their results on Monday by 1 p.m. For our students, to minimize any disruption in learning and to ensure that we continue a healthy and safety environment for our students, we're asking that all of our students meet this requirement of producing a negative test by coming to their school on January the 3rd in the afternoon from 1 to 4, and then they can also pick up a test between 8:30 a.m. and 4 p.m. on Tuesday, January the 4th. Students will be required to administer their tests on Tuesday, January the 4th. We will not consider any other negative test that is produced before January the 4th. Again, we're encouraging all of our families to pick up the test on January the 3rd, or they can pick it up on January the 4th, and we would have all of those results uploaded by 4 p.m. on January the 4th. Any student that does not have their results uploaded by January the 4th will not be allowed to attend school on January the 5th. We're asking our families to report their results through our website, and that is dcpsdc.gov/safe return. They can also receive directions on how to utilize the rapid antigen-based kit through the kit, which includes directions and also a video. And then we're asking families to upload information such as their email address, the student name, contact information to show proof that they provided a negative test. We are also providing technical assistance to families. They can call 202-442-5885 for assistance in regards to the antigen rapid test should they have any questions or concern. It's important to note that the antigen-based kit that is being provided through DCPS and also city sites provides families the capability of producing a PDF of their results that can be uploaded, or families can choose to take a photo of their negative results and upload those as well in the site provided. If a student tests negative, we ask that they continue to monitor the child and their symptoms for COVID-19, and if they're showing any symptoms or any symptoms within the family, that they quarantine that individuals or those individuals accordingly. We're also reminded that we are asking all of our families to continue to get vaccinated as much as possible. We believe that is continue to be the best way in which we protect individuals and their family. If a child tests positive, we're asking that they reach out to their school's main office so that their absence can be noted accordingly, and they also follow the guidance as relates to isolation and reporting to DC Health or the child's healthcare provider as well. Again, just a reminder to all of our families, for any student reporting to school on Wednesday, January the 5th, all students will be required to provide proof of a negative test before returning to school. We'll also be sending out reminders to family, and we'll be hosting a teletown hall for families to gather more information about our protocols. We're also reminding families that we're continuing to follow our process for reporting isolation and how we investigate cases, and then how we notify families of any positive cases and when there's time to quarantine. We ask that families again notify us of any time period in which a student tests positive, so we can follow our contact tracing protocols and we can notify families accordingly that would be impacted. Those are all of the education updates. Again, we remind families to go to schools on January 3rd from 1 to 4 p.m. and then on January the 4th, that Tuesday, between the morning time and 4 p.m. and then load up those results on Tuesday, January the 4th. And it's important to note that the results should be administered from tests that are taken on January the 4th. Thank you, Mayor.
Thank you, Chancellor. And just a few quick other reminders. Christmas tree pickup will be at the point of your trash collection. So if you receive a curbside pickup, put your Christmas tree near your trash between January 3rd and February 28th. And because our DPW crews are working so hard, those materials will be able to be composted. So keep that in mind and make a plan for your holiday greenery. Similar to our Christmas guidance, our New Year's Eve guidance is to know your status before you go around other people. Get vaccinated and boosted. Wear your mask. Only attend or host small gatherings, and avoid indoor or outdoor areas that are poorly ventilated. And being outside is better than being inside for those activities. So keep those in mind as you make your decisions. Fresh Start 5K is going to be all virtual, and we have several locations where you can pick up your materials. So please go to fitdcfreshstart5k.com, pick up your t-shirts, make a plan with your family and friends, see some beautiful routes that we will post around the city, and post those pictures and do your Fresh Start 5K. The benefit to this is that you don't have to get up at 10 a.m., but you can do it whenever on New Year's Day. So with that, we've completed our updates, and we will take a few questions.
I'm wondering, is there a metric now tied to school closures at all? Previously, that hasn't been the case.
Well, the chancellor has already discussed that he will be able, with his team, to review the staff availability and the impact on a school of positive cases or quarantines, and be able to make a decision. It's not because every school is not the same in terms of programs and services, or who might be impacted by the quarantines. It is a case-by-case basis. So they will make that review between 4 p.m. In the evening and post that for schools to review. DCPS will continue to update the experience at the school level on its website.
Do you know how many staff are impacted right now? How many are, COVID positive or quarantining? Or
Let me ask the city administrator, do we have that we would know, roughly for our schools, yes, for DC public schools.
There have been about 650 DCPS staff, that's more than just teachers, remind you, who have tested positive between November and through December, including about 60 at the end of December, when we start to see the big increase in citywide cases.
Are there any campuses that might not return on Wednesday because of staffing or other reasons?
Well, the answer is we won't know until we have completed what might be one of the biggest, for us, is going to be the biggest data collection effort throughout COVID. Keep in mind that in our public schools, including our public charter schools, we have over 90,000 kids. And I'll ask Superintendent Grant to talk about the posture of our public charter school community as well. We're expecting all of them to take a test and report a test on Tuesday.
Are there
So,
schools as well?
yes. I'll ask Superintendent Grant to speak specifically to their posture.
Great. Thank you, Mayor. And yes, charters are participating in the Test to Return initiative. We would encourage parents and families to visit each of their charters' websites, reach out directly to their school to get guidance on how they will pick up their test on January 3rd and 4th and report back for reopening. And so it's important to note that all of our schools, DCPS and charters, will have access to these rapid kits so that they can test and have elevated surveillance in their school communities.
Thank you.
Yes?
This question's for Chancellor Farabee and Dr. Grant. It's my understanding in speaking with teachers and staff members at various schools that oftentimes it's hard to uphold the mask mandate with, youth who like to buck against the system. In addition to that, with the asymptomatic testing, especially with high schoolers, when they come into the school building and they drink water or they might chew gum, it's hard to get the results from them. Given all of that, what is the conversation and the strategy around maintaining fidelity to the COVID protocols with all of that in mind?
Yeah, thank you for that question. And it reminds me, one, to call out in the presentation what was noted as relates to staff access to masks. So staff will have access to KN95 masks when they return. And I mention that because I think it's important to note that we have reminders across our system for both adults and young people. And we see the need to remind young people and adults throughout the day to fully cover their nose or ensure that their mask is properly fitted. I have seen strong compliance for my students, whether that's during the school day, extracurriculars outside of school, so we anticipate that. But from time to time, we do have the need to remind people, and when we do need to do that, we do it. I have not heard directly from our school administrators that that is an area of concern. We have elevated our efforts to ensure that we have more students that are participating in our asymptomatic testing protocols that address some of the concerns you raised about gum or eating that impacts their ability to take a saliva-based test. And Dr. Grant can talk a little bit more about some of our successes and challenges as relates to our asymptomatic protocol.
Thank you, Chancellor. I don't have much to add, except that we did learn lessons around time of day to produce and take a test from a student. And so we avoid morning time when students have just had breakfast. We try to avoid lunch, and we've operationalized the schedule, particularly for next week, where every DCPS school will have surveillance testing in addition to the Test to Return initiative that we are standing up.
Couple follow-up questions, if you don't mind. What's the status right now of substitute teachers? Earlier in the year, there was an influx of funding given to the schools, and there was an announcement about recruiting substitute teachers. Has there been any consideration of recruiting them and bringing them into the schools, even to prevent school closures? What's the conversation around that?
Yeah, so with our substitutes, we have seen an increase of individuals in our applicant pool. Some of that has been response to the incentive we put in place for retirees to come back and help us, which was a recommendation from our labor leaders, which we've seen some success in. And then we've also added additional contracted substitute support. That support should be available to schools in January. We have a number of individuals that are already in the screening process. And then we're also screening central service staff to serve as substitutes as well. But the sheer number of volume of individuals out to various reasons has just created a large demand for substitutes that exceed the pool that we have, but we're confident that the strategies that we put in place will allow us to continue to build that pool up.
Thank you. And this one's for the mayor. So between the 3rd and the 4th, what is the contingency plan if, in fact, or as a matter of fact, what's the threshold to totally shut down the system and bring it to virtual, with the test results coming back and all?
That's not our expectation. Our expectation, as I've mentioned before, is that we will look at every school community based on the system's review of who's, staff availability and that school's experience with COVID and how the principal can operate the school. So it is, as I mentioned, we're going to be, I don't know anybody else at this point in time that is going to get 100,000, almost, it's never 90,000 some results in the same day. It is very important that our families and kids participate. So after having 2 weeks out of the building, every school at that point, even the ones that transitioned before the Christmas holiday, would be eligible to open. And we have to look at that data on Tuesday and make some decisions. Does that answer your question? Okay, yep.
Hi, I want to be very clear. The largest data collection effort, you're specifically referring to this testing to return to schools.
That's correct.
Okay. Can you just talk a little bit? We're not hearing a lot of other districts doing this. Can you talk a little bit about why this was something that you all determined to be the best policy, and how you sort of took into account the fact that cases appear to be continuing to rise and we still have such high levels of community spread at this point? Just kind of curious how you arrived at this decision and why you think it's the most effective one.
Well, we've been very aggressive, and we've talked throughout, and we've emphasized testing throughout our response to COVID, and we have been proud to stand up an infrastructure that can support it. When DC residents need a test, they've been able to get a test. And similarly for this surge in an environment where people are vaccinated, and where people can continue to go to work and school, it's important that they have access to rapid testing. And I think just last week, what did we say the number was? We delivered over 100,000 rapid tests to DC residents. We have also been able to deliver to all of our public schools, including the public charter schools, an allotment of tests that will allow us to know the status of students just as soon as we can, just as soon as possible. So they're testing the day before. On Tuesday, they're going to provide us that proof of test. And so that is our best assurance, our best ability to know that our staff in students who are in the building have tested negative for COVID. But our commitment doesn't end there. Families are still going to have to monitor their kids. They're going to have to keep kids home if they're sick. They're going to have to give them a test when they need a test so that we can continue to maintain a safe school environment. We expect that we're going to be in this winter surge for a few more weeks. So throughout January, that we're going to have to maintain vigilance about access to the building, and that we're going to do our part in the buildings, and we're asking families to do their part. To the question about asymptomatic testing, I also asked Dr. Grant to look at our asymptomatic protocol, especially week 1, Wednesday, Thursday, and Friday, to see if we can enhance the number of children involved in that process. And I think we've been able to get it up a little bit. So
Yes,
can you speak to that?
Yes, Mayor, thank you. We are working to ensure, as I stated, that even though we won't have a full week of school, we will still ensure that all DCPS schools have access to our asymptomatic and symptomatic testing program. And we're working with vendors to increase capacity at schools where we've determined we would need a larger sample of students tested.
And just to follow up regarding hospitalizations and the admissions in the last week, can you just clarify what you mentioned? I know that the hospitalization rate remains about 2.5%, but can you explain the 50% of new admissions in the last week? Are those all COVID related, and is that something that's concerning to you? And also just another question about the CDC guidance. It's obviously come under a lot of fire. Just obviously it's something you guys are going with, but do you have any concerns about this fifth day return to life with the mask going forward?
Thank you for that. The data that I presented on hospitalizations was specific to COVID-19. And so if you look at those slides, what we're saying is if we look at the entire month of COVID hospitalizations for December, 50% of those we saw within the last week.
Okay, put up slide 5 and 6 for our friends at home who can see the slides.
And so that just shows, and while we see that it's like you said, about 2.4, 2.5%, we see that there's a sheer volume of cases, right? And so when you just do the simple math, that means that there's going to be more people in the hospital. The good news is that that number has stayed low and has actually been lower and continuing to get lower. So we'll see more patients in the hospital. Our hospitals are prepared for that. So it is concerning to see anybody in the hospital. With regards to the CDC guidance, we typically receive advance notice of CDC guidance before it becomes public. We did not have the opportunity this time. The CDC released that, and we have had some dialogue across the country with the CDC regarding this guidance. We're still reviewing it. The CDC has tremendous scientists and physicians that are leading the way on this research, and so we're continuing to review that and have conversations with them.
Thank you all so much.
Thank you. Yes, Mark?
If I could just go back to schools and just for a couple of clarifications. Charter schools, every charter school, you say participating, I just want to make sure that we report this correctly. Every DC public and charter school will have this requirement to return.
Requirement is specific to DCPS. Families should follow up with their individual charter school to understand how they are doing a test to return program.
So not all charter schools are making this requirement.
All charter schools are testing. All charter schools are not making this requirement.
I appreciate that clarification.
That's fine.
For DC public schools, is the requirement for all ages pre-K and up?
Yes, pre-K through 12th grade.
Okay. And if somebody has a positive test and they can't come back to school, positive test and they can't come back to school, then they have to follow the protocol before they can return. That's
correct. They
okay.
follow the same protocols
And then,
as before.
Just looking at the logistics of this, I mean, you acknowledge this is the largest data collection. We've, things go wrong. I'm just looking at January 5th. What are the logistics of how this will work? Will students be allowed in the building before? Will they be screened at the door of the building before they're allowed to enter the building? Will be in homeroom where they're vetted out and the ones who don't have proof are asked to leave? I'm just wondering what January 5th, looks like it could be a logistical nightmare for everybody.
Yeah, thank you, Mark, for that question. I mean, we certainly weigh this decision and believe that it's very important that we elevate our surveillance at this time. And students will not be permitted to be in school. Now, what that means is some students may be turned away. We'll continue to reach out to families. We're asking every family to get tested. Tests are widely available across the city, and they can go to their school. It doesn't even have to be the school that they're assigned to. They could go to their closest DCPS school, but it's important that every family tests. If a family doesn't test, we should see them with their child on the 5th, and we'll give them a test, and they're welcome to test their child. But we may need to turn some students away, and we're prepared to do that.
Okay, so if I can follow up on that, because I think that was new information there. So if somebody shows, you'll have testing available on January 5th at the school for those students who weren't able to take.
We'll have test kits available to families. So I'm not saying that we're
test right then and there and get.
Or they could do it like we asked on Tuesday.
Right, but Mayor Bowser.
I understand that, Mark, but I don't want you reporting, come to school on Wednesday and take your test, because then it will be a nightmare.
Right, I appreciate that. but you-
Because, let me finish. Monday and Tuesday have been set aside that were instructional days so that we can provide all of our families with and staff with the test. We're asking them to pick it up. They have all day Tuesday to do it. It takes 15 minutes, a couple more minutes to upload the results, and then you're ready to go. It is true that we have asked our principals and teachers to do a lot. Please, families, don't also ask them to do what could have been done on Tuesday. We're providing the test. We're asking you to do the swabs, wait 15 minutes, and upload the results with the proof of the test. That's it. And then we can be there. Trust me that the principals are right now thinking of how to make that the logistics of a child that may not have access and their family needs some additional support to support them. But that should not be the rule.
Okay, can I just? and
Yes,
and
of
appreciate it,
course.
But you've never, I mean, we'll never have 100% compliance with everything.
That's
anything,
correct.
Right, so you know people are gonna show up January 5th without proof of vaccination, and I'm just wondering, will they be
Proof of
allowed in the front
testing.
door?
They
the
will
screen-
not be allowed in the front door.
Okay, so the screening process will take place at the front door.
Wherever it takes place, they will not be allowed inside the front door.
Okay, and then, but they would possibly have the and I know you don't want to advertise that, but that, so if they just didn't take the test, let's say they didn't have a positive test, but they didn't take the
Yeah.
test, if they took it on the 5th, they'd be allowed to come in on the 6th.
What day would they be allowed
That
to
is
come in?
correct.
Yes, that is correct.
So as soon as they do it, they're allowed to come back in.
They
Yes.
could take the test, go stand outside for 15 minutes,
Okay. And
show
what
the
if
test,
someone were
come back to
bring
school.
some type of proof with them, the PDF proof on the 5th, rather than uploading it to the website? You know, we weren't able to do that for whatever reason, but I have the printout here.
I mean,
Can
I
I
think
bring
what
that on the
what you're
5th?
describing, you know, reasonable people, we would definitely give access if someone's able to produce evidence on the spot. But what we don't want is, you know, the vast majority of people waiting to do that when they can do that on Tuesday. So we're asking everybody, as the mayor described earlier, to support our schools in this safe return and complying with the requirement in testing on Tuesday. But if for whatever reason they need to bring evidence of a proof on Wednesday, they can. But it's important to note that the test has to be within a 24-hour period when the student is slated to return to school.
I appreciate you indulging me on all this. Thank you.
Yes.
Thank you. Throughout the pandemic, we've done pretty well in DC. We've never had the really high case rates that some other states have had, really until now. All of a sudden, DC has the highest case rate of any state in the country. Do you know why?
The case rates are high all along the eastern seaboard, including in Maryland and Virginia.
Absolutely. Why do you think that the DC region, Maryland, Virginia, DC, have such high case rates right now that we've never seen before?
I don't
I don't know either. I wonder, Patrick Ashley, do you know?
Thanks for the question, Julie. I mean, I think we're looking at it. You know, we're learning more about COVID. Omicron is one of the topics du jour that we're talking a lot about, and you know, it has different characteristics of disease. And so I think we're going to learn a lot from this specific spike. You know, we've invested heavily in the infrastructure and the mitigation strategies that we've done here in DC, and so we'll continue to learn from this.
And can I clarify a couple of things earlier? First of all, the new CDC guidance that you presented about quarantine and, you know, if you're asymptomatic, you can quarantine for 5 days. Does that apply to the schools, to kids who test positive?
It's a great question. And so just to be very clear, we're still reviewing this. We know that we're going to adopt this, but we have not yet published this as official DC guidance yet. In our conversations with the CDC as recent as last night, we know that CDC publishes population-specific guidance, and then they also publish guidance for the general public. On Monday, for example, they published specific guidance for healthcare workers. So this general population guidance that we talked about does not apply to healthcare workers when they're functioning as healthcare workers. The CDC also has other guidance documents specific to populations such as Department of Corrections, also for schools and other high-risk environments. What the CDC is telling us is that this general public guidance does not apply to those populations, and the CDC is in the process, just like we are, of updating all of the guidance documents based on what they know from across the world and what they're learning about Omicron as well.
Okay, so right now the school's rules are all the same. Kids who test positive stay home for 10 days. Kids who are exposed or close contacts stay home. None of that has changed.
The CDC has not yet changed that.
Okay, great, thank you. And you said that there were 16,000 rapid test results reported
Correct.
back to you. Do you know how many of those were positive?
833.
833, thank you. And for people who are taking rapid tests at home right now, can you explain to them why they should report a negative result? Why, people might say, why does the health department need to know I tested negative?
Sure. So we obviously want to know who is testing. We want to know what populations have COVID. We also want to know what populations do not have COVID, right? And so that's why, it's important for us to look at surveillance from a number of different angles and approaches. It's why we look at hospital data separately, then we look at death data versus the general public. And so it gives us yet just another data point to be able to understand what is going on in the population.
Thank you so much.
Hi, Mayor. I have a follow-up question from yesterday on the implementation of the citywide vaccine mandate. Why was the decision made not to require a valid photo ID when someone, let's say, presents their COVID vaccine card to enter
I think
a
we do
business?
expect to require that. The guidance hasn't been issued about that yet, and I think that's where we're going to land.
Okay, so someone will have to present their photo ID
Yep.
and their vaccine card.
Mm-hmm.
Okay, thank you.
You bet. Any other questions? Okay, last round. Yep, Julie?
One more. Your guidance about New Year's parties seemed very good, telling people to go to small gatherings. Are you in touch at all with hotels or nightclubs or venues that usually host really big New Year's parties to give them any guidance on what they should be doing?
That is our guidance. That's the guidance that we're issuing. And so the guidance is largely for individuals.
Are you specifically communicating with those venues, maybe talking to them about ways they can make their party safer?
I just discussed
it's
the
for
guidance with you.
individuals,
And so the Department of Health also makes available, what do you call the consults you'll do?
Yeah, we do provide consults to all of the facilities that request consults.
Thank you.
Yes.
A couple of quick follow-up questions. For DC Public Schools, the 2 days that students will miss, the 3rd and the 4th, how will they make those days up? Will those be considered snow days? Just what happens to those days? And what do you say to parents who are concerned we're losing more time in the classroom?
Yeah, so thanks to the support from the Office of the State Superintendent of Education, those days will be waived, so those days will not be required to make up. And I'm understanding that'll also be the process for the public charter schools as well.
That is correct.
And then can I ask a follow-up from the other day, Mayor Bowser? Have you reached out for the National Guard, and have you gotten an answer back? You were going to request them to help assemble the kits.
We have, and I think their first day, that request was approved, and they are, I think, reporting to the warehouse today to help us with kit assembly.
And then, Deputy Mayor, can you update us on the exemption requests and discipline, and if this is data you want to forward after this rather than eating up all our time, I'm happy with that. But you know the data.
I can forward the data afterwards. Okay. Nothing has fundamentally changed directionally in the data, but I can make sure you get it after the press conference.
What kind of masks are going to be distributed to students, teachers, and staff at the DC schools?
So we are currently in the process of distributing KN95 masks to schools for staff, and we'll continue to distribute our surgical masks that we've distributed to students in the past if they don't come with a mask, but the vast majority of our students do come to school with a mask.
So in terms of the KN95 mask, you're saying what proportion of that will consist of those types of masks, given how Omicron has evolved?
So right now, our posture is to distribute for staff when they return as it relates to KN95, but we haven't made any changes outside of that plan.
Okay. Thank you, everybody.